Okay, quick update. Picking my son up from school. I got about 10 minutes, so I wanted to just get an update up there because I had a procedure yesterday. So I was planning on having this procedure for a while. I think I spoke about it in a couple prior videos. The procedure is called a YAG laser capsulotomy, or a laser YAG capsulotomy, but it's a YAG capsulotomy where in my right eye I had a couple of vitrectomies, one with air, then one with oil, and then they removed the oil and did a cataract surgery at the same time as removing the oil. So that eye that got a little pulverized with multiple vitrectomies developed a cataract quicker than my left eye, which had a one vitrectomy about 2 years ago, which is due for a cataract surgery, which I can get into after this. But yesterday I went into the office, awesome place, Manhattan Eye and Ear Institute in New York City, and I saw my cataract doctor or surgeon, and so I developed what's called a secondary cataract. And what that is when they do the lens replacement, usually your vision is super clear. I have like 20/20 distance vision in my right eye after I had that cataract surgery, and I noticed over the months and about a year following that my clarity was going down a little bit, and my night vision was really bad. I felt like I had kind of like a halo effect going on. And I spoke to them a couple times, and they said, well, it looks like you're developing a secondary cataract. It's really common. We can do this procedure, but we'll want to wait a little while. So it was time. And I got to tell you, I went through this procedure. For anyone who had a vitrectomy, who then had to have a cataract surgery, you may have to go through this. It's very, very common. But what I'd like to tell you is that the procedure was a breeze. It was about 10 minutes, maybe 5 minutes long. They strap you into like an upright, it almost looks like you're getting some imaging done on your eye, but you're sitting in front of a machine that specializes in this surgery, and it shoots laser, like a cold laser, into your eye. And what they do is I think they open up the capsule, which is behind the lens. So they slide that lens into your eye, and it's in a kind of pocket in there. And they, that pocket on the back side sometimes can get a little film developing in there. So they blast it with a laser, and literally by the time you're done, I noticed the difference as he was doing it. Like each pulse was like, you could hear the crack of the laser. And like each time that happened, it would get brighter and clearer. And that was with, he put gel in my eyeball and stuck a glass lens right on my eye to keep my eye, stationary. But I walked out of there and noticed an immediate difference. And I'm putting steroid drops in 4 times a day for 5 days, but I have zero pain. The procedure itself was zero pain. A little scary hearing the laser crack, and but other than that, super smooth. And the best part, he said, you can lift tomorrow. So of course I was at the gym this morning at 4:30 doing legs like nothing happened. So just wanted to give an update. Anyone who has to have this procedure after their vitrectomy or after their cataract surgery, it's nothing to be worried about. There are potential complications that they told me about, which are scary to hear. Floaters and possible retina detachment. But he said in his whole time of doing these, he's been doing these in the city forever, he's never seen a detachment happen from a YAG capsulotomy. So to be safe, he scheduled a follow-up appointment in 4 weeks with my retinal surgeon just to take a look at the retina, make sure it's cool. But I gotta say, it's an amazing time to be alive. I got blasted with a laser yesterday and I'm fine. I'm seeing perfectly again, 20/20 in that right eye. In April, I have an appointment for my left eye to see if I'm a candidate for this new lens that will allow me to read and see distance, despite the fact that I have an astigmatism. So super excited for that. And hopefully, you know, we all hope for the end of the story, because this has been a 2-year journey for me. And of course, I'm going to have to go to the retina center for the rest of my life just to make sure everything's good. But hey, once this eye's done and my cataract is resolved, hopefully that's it. Maybe I'll stop making these videos eventually. But anyway, I wanted to get this out there just for anybody who's going through the same thing, and just to let them know that you know, this process and this procedure was painless and quick and super effective. So hope everybody is doing well. Drop a comment if you have any questions, and I will do my best to answer them all. Take care.